So with that said, I love in the dentistry world, I love fixing teeth. I know that sounds kind of crazy, but fixing teeth, in my terminology, what I like to do, I want to bring back people their smile. So when you walk into our office, me and my husband, we focus on what's called full mouth reconstruction. And that sounds kind of weird, but like full mouth reconstruction, yes. I analyze your smile, I analyze your lips, I analyze how you function, how you eat, and especially that's my main thing. And my husband will make sure that restore whatever you're missing. So he's focusing on surgeries, implants, extractions, and for the older generation, he tends to upgrade them in the what's called the denture world, right? There's a lot of cool things about that, but that's his side. And I'm gonna talk about what I do. So I focus on the cosmetic part. I come and I also work on the alignment part. In the alignment part, everybody knows what alignment means. If you don't know what that means, it's making a tooth straight from his original position. Why do we want to align our teeth before we restore them? Well, first of all, if you don't have aligned teeth, they'll start to break off. And the functions of chewing and biting are so strong, our forces, that are going to crack. And if you're going to crack, that's what happens with the bacteria coming in, and you have a huge cavity or a crown, etc., etc., etc. So that's a part of aligning. I align with two methods. Invisalign, which is a brand, it's a clear aligner that is more of a compliance of the patient to wear it every day, and then they'll shift the teeth in a transition of different aligners, or the fast braces, which is a typical orthodontic bracket, but his point of fast braces, it creates bone while it's moving. So if my tooth is on top of the other one, when I put it in, it'll unravel the teeth, and it will shift it to the point that will create some bone, and then you don't have any issues with gum disease, tartar buildup, and also your function will get back, alignment, aesthetics will come up, and you will bite, and there will be no crack. And stress fractures, what we call stress fractures or cracks, right? So anyways, that's the part of alignment. But in cosmetic world, which I love, and I've been getting myself trained more and more and more, is not just bright teeth, perfect teeth, white teeth. We also, as dentists, we need to analyze the face of the person. What I mean by the face of the person, especially the lower part of the person, if I make beautiful teeth and I put them white, but you have a gummy smile, the teeth will never show up as nice as if it would. Or another example, I fix the teeth, I whiten the teeth, or I do veneers. Veneers, we have two versions of veneer. We have the traditional veneers, which people that don't want to align their teeth, which is very aggressive. And we have the famous lumineers, where a very thin contact lens type of cap that you put on your teeth. So if I make all that beautiful smile and your lips are small, or your what we call asymmetry is off, like your lip is down, one side down, the other one's up, this is where the part of cosmetic comes in. This is the part of dermal fillers come in. And you'll think, well, why a dentist is putting derma fillers? Well, think about it. Who is better that knows your anatomy of your face, because we go through all that a lot, and knows your functions of your bite and your lips and everything, and knows how to put all that beautiful smile to an asymmetry of your face? It's the dentist. The dentist has been trained to do everything, and at the point that we like to see everything perfect. So who's better than the person that's fixing your mouth if they are certified to do the dermal fillers? So the dermal fillers, the brand that we use in Kendall Breeze is Juvederm. And for those of you who haven't heard, Juvederm is from Allergan. They do Botox, which we also do Botox, and I'll talk a little bit about that. In the Juvederm world, we have, in the part of dentistry, we have three types of Juvederms. We have the one that fixed our nasal labials, our lips, and also internally. And you will think, well, why internally? Why would I want to put dermal filler inside my mouth? Well, I'm not saying we're going to put it inside your mouth, but a lot of people, when you get older, or people that have gum disease, the gum that protects our teeth tend to get flattened. And when that means flattened, it creates what in dentistry world we call the triangle, black triangle. Black because it's a hole. And there's no way that any cosmetic can bring it up. There's no surgery of gum can bring that up. So the studies have shown that putting dermal fillers in the papilla, which is that gum, it'll float it up and it will cover up that black hole. At the same time, it's good for hygiene, so the hygienist will love you on that. No food gets stuck in there. There's no exposure of that root or anything. So that's why we use derma fillers. That was my intention of learning derma fillers, to help my husband, especially when he puts implants, which you're restoring some place that never had a tooth before, or they recently removed the tooth to create that, what we call papilla, which is the gum, the tissue that's surrounding your teeth, to create it back to the point so the cosmetic looks good, but at the same time, it protects my teeth so you don't get cavities or there was exposure. So the Derma Fillers is very, very, very known on the implant world and what we call the black triangle. So of course, I use it, if you learn that, you're gonna learn how to put it on the folds, on the commissures. A lot of people that have dentures, their lips tend to drip, especially when we get older, we're losing our collagen, the elasticity of our skin, you lose your glow because you don't get hydrated. So these are places that you can retouch. It is a natural gel, which we have it in our body. I know that I get really funky on this word, is hydrochloric acid. Oh, whatever. I'll put it up. Hyaluronic acid. You've probably seen it in a bunch of commercials like L'Oreal and all these big cosmetic world. They do creams out there that you can put it on your face and it will absorb a little bit of it. But it's hilarious because I'm Puerto Rican and I know my name doesn't make it like it's on Puerto Rican, but hyaluronic acid. So it's an injectable gel. And those people say, well, Dr. Schmeiser, this lasts forever. I'm like, nothing lasts forever. Even when we restore teeth, my point of telling the patient, listen, we're restoring you. We're giving you a life. You're going to be healthy. You're going to be able to chew. Your digestive system is going to work better. But nothing lasts forever. What does that mean? Is like you got to maintain it. Maintaining is not just at home. There's a reason why you got to go back to the dental office, even me, sit down and get a full cleaning every 6 months or every 3 months, depending on what kind of stage your mouth is in. But when we restore a full mouth, you're giving a person a 10-year lifespan. Like your body's gonna be different. You're gonna feel better because now you can chew. Your vitamins, if you chew better, then you'll be able to reabsorb better. So anyways, so with that said, Derma Fillers are beautiful for that. Also for older people or people that don't feel like they have a good lip, you can redefine the lip and you can volume it. I'm not telling go all Kylie Jenner or the Kardashians. If you want, you can get there. There's just steps for you to get there. And for Juvederm, they have three types. They have Juvederm Ultra, which is for people that are my age. I'm not saying I'm young, but the 40s and under, or 50s and under, which is the Ultra. You don't need that much of plumping or volume. And then, of course, you have the Juvederm Ultra Plus, which is for people that are in the more older age. And then they just came out, I'll say maybe a year now, with the Juvederm Volbella. Before, those two Juvederms, we were able to use it on the lips. But they noticed that the amount that you use and it will go away because we function so much in our lips, it didn't last that long. It was too, not watery, but it wouldn't last, the gel wouldn't last that long. So they created Volbella, which is a little bit more, how do I say it? It's a little bit more thicker, and it will last up to a year, which with the other two Juvederms, we're only looking at 6 to 7 months before it starts to go down. So those are the 3 Juvederms that I use, and then I love it. I mean, people look amazing after they come out. I mean, it's kind of hard to think like, oh, I'm another needle. Who's better than a dentist that knows how to work a needle? So it's very, very small needle. So the Juvederm is a very trendy thing. If you don't know what it is, you're more than welcome to come to our office. I'll give you a consult and explain, okay, listen, you don't need that much, or we're going to touch these places, let's volume it, and then we'll get to the level that you want. Because remember, you can't spread the skin that fast. The other cosmetic part that we like to use is the Botox. Okay, why do we use Botox, Sharon? You're a dentist. Focus on your teeth. Yes, I understand that. But did you know that if you have a gummy smile, and I told you about that, Volbella or Juvederm are not going to bring that lip to where you want it. And this is why we study the Botox. If you know that Botox is a Clostridium botulism, if you don't know about that, it's the same kind of, it's not the same, but it comes from the tetanus disease, okay? So it paralyzed the muscle in a way. So if you have a gummy smile, what it is that your muscles around your mouth, they shrink too much. So what they do is they stop them, so then you don't have that gummy smile. So Botox is known for that. Botox is also known for a lot of people that have clenching. Clenching means grinding their teeth at night, and what do? They get the famous TMJ problem, headaches, and that stuff. So they notice that with Botox, you relieve that muscle. It's a muscle spasm, so you relieve it and less headache. But if I already learned that, why not just help the patient also to look beautiful in the front towel area? If they don't like their the lines and the one in the middle and on the sides, that can be done. So it's amazing. I just want to say out there that we are doing that. I just don't promote it as much, but I was like, what the heck? Let me just talk about that, because every time I'm with my husband, he wants to talk about other stuff. So this is my time. But I'm going to tell you straightforward. You don't have to be to our office to meet us. We have been very cyber for a long time. We have what's called in our office a cyber smile. We do a complimentary consult with any of us, and we will look at you. And now with COVID, it's huge, the teledentistry. So for that, it's been humongous. It takes away that long-term period of waiting in our office, meeting the doctor, seeing if you like him, you don't like him. This is where we break the ice. We will love for you if you need one. Just type in my page, Cyber Consult. It'll pop up. We'll schedule you in at whatever time is comfortable, and we can go ahead and figure out what's going on. And if we can help you, we can help you. For those of you who don't know me, I'm Dr. Sharon Schmeiser, and my husband is up in the office because that's how I have him. No, I'm joking. But if you have any comments, go ahead and comment, share with your friends. And if you didn't know, now you know. So enjoy it, have fun, and be safe out there, okay? Take care.